In this episode of This Week in Startups, Jason Calacanis interviews Gabriel Jones, the co-founder of Proprio, a company that is using real-time computer vision and AI to revolutionize surgical procedures. Proprio has developed a system called Paradigm that combines sensors, imaging technology, and AI to provide surgeons with a real-time, high-fidelity view of the patient's anatomy during surgery. Jones explains that the current standard for surgical navigation is like using MapQuest for directions. Surgeons rely on printed images or screens to guide them through the procedure, but this method is limited and prone to errors. Proprio's system, on the other hand, creates a 3D model of the patient's body based on pre-operative imaging, and then uses real-time sensors to track the surgical instruments and update the model in real time. This allows surgeons to have a more accurate and detailed view of the patient's anatomy, leading to better outcomes. The system uses a combination of sensors, including cameras and infrared technology, to capture depth information and create a live 3D model of the surgical site. Surgeons can view this model through a headset or on a screen, and they can interact with it in real time. The system also has the ability to track the movement of surgical instruments and provide guidance to the surgeon, helping them to perform the procedure more accurately. Jones emphasizes that the data collected during surgery is the most important aspect of the system. Proprio captures detailed information about the surgical procedure, from the initial plan to the outcome, and this data can be used to improve surgical techniques and train AI models. By analyzing this data, Proprio aims to identify patterns and best practices that can be shared with surgeons to improve their performance. The initial focus of Proprio is on spinal surgeries, which are complex and often require precise navigation. Spinal surgeries represent a large market, with $30 billion in reimbursements in the US alone. However, Proprio plans to expand into other areas, such as brain surgeries and knee surgeries, where similar navigation challenges exist. Jones also discusses the potential for remote surgeries, where a surgeon could perform a procedure from a different location. While this is technically possible, there are still challenges to overcome, such as latency issues and the need for a local team to assist with the surgery. However, Jones believes that as the technology advances and more data is collected, remote surgeries could become a reality. Overall, Proprio's goal is to improve surgical outcomes and reduce costs by providing surgeons with real-time, high-fidelity navigation tools. By leveraging computer vision, AI, and data analysis, Proprio aims to revolutionize the field of surgery and make it more accessible and effective for patients. Thanks for watching. If you enjoyed the video, please like and subscribe.